Health and Human Services Secretary Alex Azar offering an updated timeline on when most Americans will be able to get the coronavirus vaccine. Meg Terrell joins us with more on that. Good morning, Meg.
Good morning, Andrew. Well, the end of February, the end of March, that is what Secretary Alex Azar told Shepard Smith last night on CNBC about when the general population will start to get access to the COVID-19 vaccines. Now, that's dependent on a number of things going right. First, can we vaccinate hundreds of millions of Americans in this record time? That's a key question, and that is happening now, of course, with the Pfizer vaccine. The second, of course, is supply. The U.S. government has currently purchased 300 million doses from Moderna and from Pfizer, the two vaccines that have proven to work. 200 million from Moderna, 100 million from Pfizer. And 200 million of those, 100 each from Moderna and Pfizer, get delivered by the end of the first quarter. The second 100 million from Moderna get delivered in the second quarter by June. And the government is working on striking a deal with Pfizer for another 100 million doses. But there is some tension happening that has become apparent this week, really through our interview on Monday with Pfizer CEO Albert Bourla, and then Shep's interview with Secretary Azar last night, where he asked, could they use and why haven't they used the Defense Production Act to help Pfizer get access to raw materials to increase the supply and speed up delivery of those 100 million doses? Take a listen to both of those gentlemen this week.
While we guaranteed purchase of $2 billion of vaccine, and that is critical for their ability to develop that vaccine and put the capital investment in, they are more secretive with us about their manufacturing capacities, their needs. So we can't know they have a raw material problem until they tell us they have a raw material problem.
We are asking them right now a few things. They haven't done it yet, but we are asking them, and I hope that they will do it very soon, because particularly in some components, we are running at critical supply limitations. But I think they will do it.
So Albert Bourla from Pfizer telling us that their raw materials are running at critical supply. Presumably, they've also told the HHS guys. Pfizer has said it can deliver 100 million doses in the third quarter in the U.S., but the U.S. wants them in the second quarter. And so the pressure is on to be able to speed up those doses and guys count on other vaccines working from J&J and AstraZeneca. And we should hear about that in January. Guys?
Well, that's what I was going to ask you real quick, Meg. We talk obviously about the Pfizer vaccine and the Moderna vaccine, given the great results that we've seen thus far. J&J, you think we're going to hear about in January? If the results are positive in January, how quick does that then come on the heels? And, how quickly does that get rolled out on the other end? Because I know they have a huge manufacturing operation going.
They do, and their shot is the only vaccine that could be one dose. And I'm so excited to get to see those data. Moncef Slaoui from Operation Warp Speed has said we can expect them in early January, because they've enrolled about 42,000 people in their trial. They were going to enroll 60,000, but because the infection rates are so high, they don't need as many people to be able to show efficacy on this vaccine. So they're going to stop the enrollment at the end of this week, Moncef Slaoui told us on Monday. And he expects that they should have essentially enough cases of COVID-19 in the trial to be able to tell the difference between placebo and vaccine early January. If it works and it shows safety, he expects it could get on the market in February.
Shepard Smith here. Thanks for watching CNBC on YouTube.